Breast infection or mastitis can be complicated by an abscess, which is a collection of pus in the breast tissue, or more severe symptoms are an antibiotic-resistant infection. In this case, the breast infection requires more aggressive treatment. When treated promptly, most breast infections go away quickly and without serious complications. Hello, my viewers. My name is Dr. Winnie, a consultant public health pharmacist and a practicing herbalist. You're welcome to my channel, Dr. Winnie the Pharmacist English version, where I discuss all things health. I also have this channel in other languages like Pidgin English. Today, from the introduction, I'll be discussing the complications of breast infection, how to prevent them, how to treat them, when to see a healthcare provider, and so on. So stay tuned. In severe breast infections, an abscess may develop. I've already said it in the introduction of this video that an abscess is a collection of pus in the breast tissue. That's with respect to the breast. Abscesses need to be drained either as an office procedure or a surgery. A wound dressing is needed to help healing after the procedure. Women with abscesses may be told to temporarily stop breastfeeding. So how do we prevent breast infections? To prevent or reduce breast infections, women should do the following. 1. Careful nipple care to prevent irritation and cracking. 2. Proper breastfeeding techniques with good latching by the baby. 3. Feeding often and pumping milk to prevent the breast from getting swollen or engorged. 4. Ensuring that both breasts are completely empty to prevent engorgement and blocked ducts. 5. Breastfeed equally from both breasts. 6. Use good breastfeeding techniques in order to avoid sore and cracked nipples. 7. See a lactation consultant for help if you need support. 8. Let sore or cracked nipples air dry. 9. Prevent moisture buildup in breast pads and bras. 10. Drink plenty of fluids to avoid dehydration. 11. Eat more balanced diets. Get more lecithin from foods like soya beans, egg yolks, and peanuts. Lecithin makes breast milk less sticky and prevents it from plugging to the breast ducts. 12. Practice good hygiene when you breastfeed. Wash your hands and clean your nipples each time. 13. Keep your clothes light and loose. Tight bras put pressure on your breasts. 14. Wean the baby slowly over several weeks rather than quickly stopping breastfeeding. 15. Timely treatment of a breast infection before it progresses to a breast abscess. Now let's look at how to treat breast infections or mastitis. Treatment of breast infections include a combination of self-care measures and medical treatment options. In other words, medical and non-medical treatment. So I'd like to categorize the non-medical treatment as home remedies. Home remedies can often relieve symptoms, especially if they are relatively mild. They include 1. Self-care. This may include applying moist heat to the infected breast tissue for 15 to 20 minutes 4 times a day. One may also take pain relievers. 2. Empty breast milk frequently through pumping or breastfeeding, starting with the affected breasts. 3. Ensure that the breasts are empty after feeding by pumping or hand expressing. That is, using one's hands to massage out the milk as needed. 4. Prioritize rests. 5. Change breastfeeding positions. 6. Drink plenty of fluids. 7. Massage the painful area moving towards the nipple to help drain the breast after feeding. 8. Try lymphatic massage. This involves massaging the skin from one's areola to one's armpits to promote fluid drainage from glands under the arms. 9. Use a cool compress after emptying milk to reduce pain and swelling. 10. Ask your healthcare provider about trying over-the-counter or OTC medications, as it is called, such as Tylenol or paracetamol or Panadol. They all mean the same thing. Or ibuprofen and so on. The next category of treatment, which is medical treatment, becomes necessary if symptoms persist or are more severe, or if there is a complication like an abscess. These include antibiotics. Antibiotics are prescribed if symptoms last more than 12 to 24 hours. They are very effective in treating breast infections. If a woman with breast infection takes antibiotics, she must continue to breastfeed or pump to relieve breast swelling. 2. Corticosteroids. 3. Immunosuppressants. Remember, always consult with your healthcare provider before taking medications, including OTC pain medications, especially when breastfeeding. 4. If there is an abscess that doesn't go away, a needle aspiration under ultrasound guidance is done along with antibiotics. If this method fails to cure the abscess, then 5. A surgical incision and drainage is done. Now, when should one contact a medical professional if she has a breast infection? One should contact a medical professional if or when one portion of the breast tissue becomes reddened, tender, swollen, or hot. Secondly, when one is breastfeeding and develops a high fever. Thirdly, when the lymph node in one's armpit becomes tender or swollen. Now, these are the different exams and tests to perform when one suspects that she has breast infection. 1. Your healthcare provider will perform physical examination on your breasts to rule out complications like swellings and pus-filled abscess. Sometimes an ultrasound is done to check for an abscess. 2. For infections that keep returning, milk from the nipple may be cultured. Also, blood tests can be carried out to check for signs of infections. In women who are not breastfeeding, tests done may include 1. Breast MRI. 2. Breast ultrasound. 3. Breast biopsy. 4. Mammogram. However, folks, there is no cause for alarm because breast infections usually clear up with antibiotic therapy. This brings me to the end of this video on my breast health series. Please check out other videos. I also have videos on breast cysts and other breast issues. Like I said earlier in my other videos, I'm doing a breast health series, so this is one of them. These videos are putting it out here to help women this year to take better care of their breasts and to acquire more knowledge so that one doesn't get unnecessarily scared for no reason. I've said it earlier on in one of my other videos that breast infections are common and they happen, and so it's not a taboo. It shouldn't be an embarrassment. The most important thing is for us to know when we have them and how to tackle them so that they don't become complicated. So if this video has added to your knowledge or you feel this video was very useful, please kindly give it a like and share it out to your friends and on other platforms so that people may be aware. Also, please subscribe to my channel to encourage me to make more videos and click that notification bell so that you may be aware whenever I drop my next videos. Also, put down your comments and questions in the comment section. I'm always readily available and willing to help. That said, thank you for tuning in. Till I come your way next time. Bye.